My audience. Today, my speech is about the process of donating blood. There are 4 types of blood donation. There are the white blood cells, the platelets, the plasma, and the double red cells. The white blood cell donation is the most common donation, where approximately a pint of your blood is taken and then separated into the red cells, the plasma, and the platelets. The platelets donation uses a process called apheresis, where the donor is hooked up to a machine that collects the platelets and some of the plasma and then returns the rest of the blood to the donor. The plasma collection is where the plasma is collected with or without the platelets during the apheresis process. And the double red cells is where the double red cells are collected during apheresis. To be able to donate, you must be in good health, which means you can't have a cold or the flu or any of its symptoms. You must be at least 17 years old to donate without your parents' permission, or 16 years old with your parents' permission. You must be at least 110 pounds, and you must be able to pass the physical and health history assessments. During the medical history part, you will be asked confidential questions about your medical history by some of the staff members. The night before you donate, you will make sure that you get a good night's rest, make sure that you eat a nourishing meal, and make sure that you drink plenty of fluids to stay hydrated. When getting ready to donate, make sure that you hydrate, that you wear something comfortable, that you maintain a healthy level of iron in your diet before you're donating, bring a list of all the medications that you're taking, bring your ID, and make sure to relax. When you're donating, when you arrive, you will sign in and you will show your ID. You will then fill out the donor registration sheet. You will also then perform a pre-donating screening, where a staff member will ask you questions about your health, your lifestyle, and about any disease risk factors. Staff members will then perform a short health exam or a mini physical, which includes taking your pulse, checking your blood pressure, and checking your temperature. This health exam also includes pricking your finger, taking a drop of your blood, and testing it to see if your iron level is sufficient enough to donate. You will then be sent to the hydration station, where you will need to drink plenty of water and other fluids before donating. The more hydrated you are, the faster the donation process will be, and the better you will feel afterwards. Then you will actually donate. You will sit down in one of the donor chairs. You'll be asked several more questions by one of the staff members, and the needle will be inserted into your arm. After the needle is inserted, it should take about 10 minutes for the pint of blood to be donated. You'll be squeezing a small ball to keep the blood flowing. After your blood is taken, then the needle will be taken out of your arm, and then the bandage will be applied. Then you will also go to the last hydration station, where you can sit, relax, and have something to drink and have a snack. After the donation process, try to increase your fluid intake for the next 24 to 48 hours. Avoid any strenuous physical exertion, heavy lifting, or pulling with your donation arm for about 5 hours. Eat a well-balanced meal for the next 24 hours. Smoking and alcohol consumption is not recommended, and donors seldom experience discomfort after donating. However, if you feel lightheaded, lay down until the feeling passes. If some bleeding occurs after the removal of your bandage, apply some pressure to the site and raise your arm in the air for about 3 to 5 minutes. If any bruising or bleeding appears under the skin, apply a cold pack periodically to the bruised area during the next 24 hours. Then warm and moist heat intermittently. Make sure to contact somebody if you later feel that your blood should not be given to a patient, if you are not sure that your blood is safe, if you become ill within the next 24 hours after your donation, or if you develop a fever of 100.5 degrees or higher within the 2 weeks of your donation, and you have no specific diagnosis.